Getting a good night's sleep is no joke. We may laugh or tease our spouse about their snoring, but there could be underlying health problems.
Today's CI Health sponsor, Gibson Area Hospital, Cardiopulmonary Care and Sleep Disorder Center. We have Lynn Wells, director of the Cardiopulmonary Care and Sleep Lab, and Michelle Carey, Sleep Lab coordinator, here talking about this very serious problem, or at least potentially. Thank you, ladies, for joining us.
Thanks for having us.
So, lots of people snore. Is it always a problem, or do some people just do it and it's fine?
I would say it is something that you should definitely bring up to your primary care physician. If you're snoring, chances are your airway might be obstructing, causing you to snore, and it could be also causing you to have pauses in your sleep.
And that's not a good thing.
Correct.
So there's help for that, but
Yes.
before you can get that help, we probably got to do some testing, and that's where you guys come in.
Yes.
So what do we need to do? Let's say Tim over here is a snorer. He calls in. Is it a sleep study that's the first step?
You would first talk to your doctor about it, and you do not have to see a specialist. You can see your primary care physician to get a referral to the sleep lab.
Okay.
You can either come in and have an overnight sleep study in the sleep lab. It's one night. Or you can do a sleep test at home with this little device here. You would just wear it one night. You would wear this device around your chest, wear the probe on your finger, and then wear a little sensor in your nose. Wear it one night, and then you can just bring it back to your doctor's office, and we will have it read by our sleep specialist.
Now, my oldest son had to go through this process on a couple of occasions, and from what I recall, you're counting the number of times your sleep is interrupted or your breathing is interrupted because of the snoring. What does that indicate, and what do you do based upon that number?
If your breathing is interrupted, then that means that your heart rate is going up, your oxygen level is going down, your blood pressure is probably going up, and your brain waves are not, you're not staying asleep. So you're waking up a little bit. It's just not giving you good restful sleep. So.
Now, what is a bad number? Like if you're at a certain place, you're like, oh, it's happening this number of times, we need to do something about this. Is there a sort of a range, a safe range versus dangerous range?
Anything greater than 5 times an hour is considered abnormal. Greater than 30 is severe.
My son's was 60.
That's
yes.
a little severe.
Which is why we had to do a few things for that.
Yes. Okay, so with this device here that you have, is that like okay, so now we know.
Correct.
So now we need to do some more testing, that kind of thing?
Correct. This device here diagnoses sleep apnea, and then you would come into the sleep lab and you would actually be treated with a CPAP machine. So it's a small device here that delivers a gentle amount of air to keep your throat open, so you're no longer snoring and you no longer have pauses in your breathing.
It used to be that those were much bigger, much louder, much more sort of intrusive, but it feels like they've made great strides in sort of minimizing the overall noisiness and size of those devices.
Correct. I would say it just delivers some white noise, like a fan, and any noise that comes out of this machine is definitely going to be better than any noise that your spouse
coming out of
might
your face
have before they use this.
They have travel-size machines that are about the size of a Coke can these days.
Oh, wow.
Wow, and I know it's important to keep those things clean, too, so that we don't get sick. Let's talk getting in to see you guys, because I hear you have some pretty convenient times to get in and not a long wait.
We do. We're just not as booked out as some of the larger facilities, so we have plenty of openings for patients that need to come in. And because our schedule is not so tight, that means that we have more time to spend with our patients and give better quality education and make sure that the patients really understand what's going on with their.
And it's somewhat ironic that next week is Sleep Awareness Week, too, right? So does that mean we all need to sleep a little bit more to celebrate?
You have an event. Do you have an event coming up with that?
I think we just recognize it in the hospital, and we provide...
It's always an event.
Provide education.
I did have a question. So let's say you do get diagnosed to needing one of those. Is there ever going to be a day where you may not need it?
Possibly. Oftentimes, once a patient gets put on a CPAP machine, they're more energized. They might be more likely to get up in the morning and go to the gym or work out after work, so they might lose weight, and they might be able to come off of the machine. So,
and younger ones, sometimes tonsils, like in my son's case, tonsils came out and he was fine. So that does solve the problem. We will connect you with everything you need to know to celebrate Sleep Awareness Week, and perhaps get yourself tested there at the Sleep Clinic at our website, which is CILiving.tv. Thanks.
Seems pretty painless.
And they really have made great strides in those things.